Hello, everyone. My name is Haris Chingezi. I'm a physician with Great Lakes Medical Imaging in the Vascular and Interventional Radiology Department. And today I wanted to talk to you about IVC filters, their retrieval, some of the problems that they can cause when they're left in, why people get them, etc. So with no further ado, what is an IVC filter? An IVC filter is a device that is placed in the large veins of the belly to stop blood clots that develop in the legs from going to the lungs. If the blood clots go to the lungs, it's called a pulmonary embolism, okay? And that can be life-threatening because blood flow cannot get to your lungs and it can cause your breathing to be very compromised. Okay, the largest veins in our bodies are in our legs, and so the largest clots that form are typically in our legs, and those are the ones that we want to protect from going to the lungs, okay? Normal treatment for blood clots is typically going to be blood thinners, but if you can't receive blood thinners, whether that, for many reasons, you've had issues with bleeding in the past or your blood clots have progressed despite blood thinners, this filter can be required to stop those blood clots from moving up, okay? That said, all of these filters are meant to be temporary, okay? They're meant to be put in, and when you are able to resume blood thinners, they are meant to be taken out. Historically, there are many different types of filters. Some of them were, not meant to be retrievable, but science and medicine has advanced quite a bit, and we're finding that the longer these filters are left in, especially when they're not needed, they can start to cause some pretty big problems. And we've developed a very strong program here at Buffalo General and Gates Vascular Institute in removing these filters to hopefully improve some of these issues that can happen. Okay, so who gets an IVC filter? Okay, if you've ever had a history of blood clots but were unable to take blood thinners, you had a high risk for developing a blood clot and you would not be able to take blood thinners. So say you were going to get a hip replacement or some other abdominal surgery, that you were going to be laying in bed for a long time, that may potentially cause you to develop blood clots, but because you had surgery, we couldn't put you on blood thinners. Your surgeon or your doctors may want to put a temporary IVC filter in place. And that's great because it protects you from that life-threatening risk of pulmonary embolus, okay? Anybody that's actively has blood clots and is already bleeding, you wouldn't be able to take blood thinners. So that's another situation in which we may want to put this filter device in to stop any of those blood clots from going to the lungs. Okay, and if you're already on blood thinners and you develop more blood clots, we know that the blood thinners may not be working effectively. Again, we want to stop those clots from going to the lungs. Okay, that said, I mentioned that these are meant to be temporary. So when should the IVC filter be removed? Realistically, the real treatment or the optimal treatment for blood clots is blood thinners. So once you can resume your blood thinners, research shows that most of these IVC filters have done their job within about 2 weeks. You can resume your blood thinners, your risk of blood clots going to the lungs goes back to normal or you don't have one anymore. And therefore the filter can be replaced. Usually because people are having surgeries or they may be in the hospital, we typically wait a little bit longer than those 2 weeks, usually around 3 months, to make sure that you don't have any more blood clots and the filter is appropriate to retrieve. And that 3-month window is kind of chosen because the sooner you pull these filters out, the less problems that they cause, the less likely they are to move, scar down, develop blood clots on their own, and some other things that I'll talk to you, okay? If your filter is already causing other issues, that's a reason to have it pulled out. And that's one of the things that really made me inspired to give this talk today is that, there's a lot of people walking around in Buffalo and around the world that may have filters that have been left in for a very, very long time. And because their symptoms progressed very slowly, or they may not be severe, or they, develop slowly over time, so people accommodated to them. They think the filter never needs to come out. It's doing its job. When in reality, every filter is removable, even if it wasn't originally intended to be. And not only is every filter removable, we're finding that by removing those filters, we can help people feel better from a lot of symptoms that they may not have even attributed to the filter. Okay, so what happens when these filters aren't removed? On the right side of the screen here, I have a picture of a filter that I actually pulled out. And you can see it's that cage-shaped device like we showed in the initial images. And at the bottom of it, there's all that white stuff, okay? That white stuff is clot and scar tissue that slowly gunks up the filter. Okay, and that gunking up of the filter causes the blood flow to be compromised back to the heart. It can decrease your ability to tolerate exercise. And, worst off is that filter can progress beyond the filter. So this device that was put in your belly to try and stop clots from going to the lungs, if it's left in for too long, can result in clots going to the lungs. And that's exactly why they can be very problematic. Okay, depending on the type of filter, these filters can erode into surrounding structures. So this is a basket type filter on the picture here, but there's others that kind of look like an umbrella. And those umbrella type filters have tines that can poke out of the IVC. They can embed into your back and cause back pain. They can go into the bowel and cause GI bleeds. They can even go into the blood vessels or the aorta and cause problems and clots, etc. And so removing these filters can really help with a lot of that. Okay. The longer these filters are left in, as that blood clot or scar tissue develops, or blood flows around these and the blood cells themselves get damaged by there being metal in the body where normally there isn't, these filters can cause an worsening venous disease, venous insufficiency. So what is venous insufficiency? Right, that's kind of the long-term outcomes of either having blood clots or having impaired blood flow back to the heart. Okay, veins are meant to return your blood to the heart. They flow from the ground up and from your head down to your heart. Okay, and veins have valves inside them that stop blood from flowing with gravity, away from the heart. When you have a blood clot or scar tissue or surgery or something that damages those veins, those valves don't close properly anymore. And so blood flows the wrong way. And most often we see this when people are standing on their feet for long periods of time, working, walking, etc., that their legs get heavy, the veins distend, the blood doesn't get back to the heart. That can result in fatigue and varicose veins and ulcers and worst case scenarios, amputations. This happens after DVT. It's a spectrum of disease called post-thrombotic syndrome, which can be rated on various degrees of severity, but overall, it can be a very difficult disease to manage. So what we want to do is try to minimize your risk of post-thrombotic syndrome by removing these filters when appropriate. And if you've developed post-thrombotic syndrome, optimize your outcomes by basically pulling the filter out and making sure we can try to restore as much normal blood flow back to the heart as possible. Okay, there are other causes for venous insufficiency. It's not always related to DVTs or IVC filters. You could have, heart disease or heart dysfunction that causes the blood to back up in your legs as well. But those are all things that your doctor would look at together and manage to try and optimize your symptoms. Okay, so what does venous insufficiency do when left untreated? On the right side of the image here, I have one of my patients that had an IVC filter that had completely blocked up and clotted off. And what we can see are the signs of the veins becoming very distended. So in her thighs over here, you can see these very tortuous and distended varicose veins. And then down in the lower legs, there's discoloration of the skin. There's redness. She's developing an ulcer. She had a weeping wound. And this is the type of thing that, if left untreated, can progress to infections and much more serious issues. Okay. Other symptoms that people will have are just feeling fatigued, numbness, tingling, tiredness, heavy legs, inability to tolerate exercise, so getting tired or short of breath when walking or taking stairs, skin thickening, flaking, just all sorts of just problems that happen in the legs because the blood is getting there, but it can't get out. And by the blood staying there and distending the skin and distending the veins and increasing the pressure, these issues develop. Now, unlike problems with your arteries, which if you block off an artery, problems develop very quickly. You have acute pain within a couple of hours or a couple of days, things go very bad. Veins are much more forgiving in one way, in that it takes longer for things to get really bad, but the disease can get just as severe. So rather than in a couple of days, it may take weeks or months or years, but the paradigm shift we kind of want to impart on everybody is that even if it's been years, and even if you think this is how you've been for a long time, and even if you think this is how I've been living with it and I've always been told there's nothing to do, that may not be the case. And there's a lot we can do for this disease process that we didn't know that we could do 20 years ago or 10 years ago, even 5 years ago. It's constantly changing. Okay, so what can you do for venous insufficiency? The first thing is always to try and manage conservatively and medically as best we can. So compression stockings can be very, very helpful. You would want to speak to a physician beforehand so we can help you decide on how much compression, and if, make sure you don't have any other diseases or problems that would affect the ability to use compression stockings, but that would be a discussion. If you're overweight, weight loss and exercise is also going to be helpful because it'll decrease the amount of blood and tissue that there is to actually pool in the legs and improve your symptoms that way. Okay. At the end of a day, or when your legs are feeling heavy and you're feeling fatigued, raising the legs so that rather than gravity pulling down against your incompetent veins, you can kind of help, use gravity to help return blood to your heart can be very helpful. Taking care of your skin, moisturizing it, making sure you stay on top of ulcers, making sure that that you minimize your risk for infections is very important. And then, taking medications and managing your other chronic diseases. If you have diabetes, we want to make sure that your blood sugar is well controlled. If you have a history of blood clots, we want to make sure that you're getting the right blood thinning medications. And after we've kind of optimized all of those things, if you're still having problems that significantly affect your quality of life, what we want to look into is potentially a procedure. And those procedures could be things like opening up a narrowed vein that may be causing the blood to back up, removing blood clots that may be causing issues with the pressures being higher in the legs, and like I was talking about, removing an IVC filter if it was related to the problems in your veins. Okay, so how do we take these filters out? There's many different ways to pull these filters out. I have a video here on the right-hand side that shows one of the devices that we use, which is a forceps. That forceps is used to grab the top of the filter, and then we can pull it out. The whole thing can come out. We also have a lasso or a snare that we can grab, these little hooks on the top of the filter to pull them out. And that video makes it look very quick and easy, and if they're pulled out in the appropriate window of time, in that 3-month window I told you about, that's usually how they go. But if they're left in for longer and scar tissue develops, they can be much more problematic, and these cases can take several hours and general anesthesia. So that's one of those things we really want to make sure we assess all of your symptoms and understand the risks and the benefits of trying to do any sort of procedure. After the filter is out, okay, if the veins are open, then great. The filter comes out, we let the blood flow, and we're in good shape. Sometimes if you've had lots of blood clot or scar tissue develop, the veins may need to be reconstructed. And by reconstruction, we mean putting a stent in the vein to keep it open so blood can flow the direction it's supposed to. The end result of this is to try and improve the inline flow back to your heart. So things are going directly from your toes, your calves, your thighs, your belly to your heart, rather than taking a lot of other little detours. And I'll show you an example of what that looks like. Okay, even if we pull these filters out, we remove blood clots, we open up narrowed veins, continued medical management remains very important. So you'd still probably need to wear compression stockings. If you're on blood thinners, we would talk about how long you need to be on them, if you need to stay on them based on many factors. And that would be a discussion with your physician. Exercise, elevating your legs, and trying to modify and minimize your risk factors is always a good idea as well. So here we have a short video of what blood flow looks like before a filter is retrieved, okay? And this is an injection done in the veins of both legs. So down at the bottom of the screen is the blood coming from both legs. And you can see it kind of goes into all these tortuous, small little branches and veins, but nothing looks like it's coming together and going straight up towards the top of the screen, which is where the heart would be. Okay, and I know that may be hard to understand as a non-physician, but when I show you the next video here, which is the same patient after we have removed an IVC filter and reconstructed the IVC, when I show you what this blood flow looks like, an injection from both legs, and you can see that the blood flow is coming together in the midline and going straight up towards the heart. Okay, and this is somebody whose symptoms improved very quickly. Leg swelling went down, ulcers improved, their ability to walk, they could walk almost 3 times as far within a couple of days. It can take longer to get better, but improving the flow really does improve a lot of those things. Like I mentioned previously, the filters can also cause back pain. They can cause, like you need to go to the bathroom more frequently, all sorts of symptoms that don't really seem tied into one thing that we find that improve after a filter is retrieved. Okay, so what else should you know? Okay, regardless of what you've been told over time, if whether you had a filter put in 1 year ago or 20 years ago, every filter is potentially retrievable. Okay, doesn't matter how old it is. It doesn't matter if it was meant to be permanent. It doesn't matter if you've been told that the filter cannot come out. I think if you are assessed by a physician like myself, who is trained in modern techniques and modern ideologies, there may be a lot more we could offer for you than historically has been. Okay. Another thing to consider is that some people may not even know that they have a filter. Okay. Sometimes you're very sick in the hospital. You've got an infection. You may be intubated. Your family is the one that helped make the decision to put the filter in because you were bleeding or whatever it may be. You come out of the hospital and the filter's forgotten about, and 10 years later you've developed these problems. It doesn't hurt to be assessed to figure out, do I have a filter? Do I have venous insufficiency even if I don't have a filter? And is there somebody who's a specialist in this disease process that can help me out with that? Okay. Seeing a specialist will open the door to the most modern treatments. Your careful conversation with your primary care physicians and other doctors is obviously going to be very important for us. But at the end of the day, this is something that we do day in and day out, and therefore we are able to provide additional expertise. Okay. And what next? So if you think you have an IVC filter, symptoms of venous insufficiency, or if you have ever had a blood clot or a PE, I'd implore you to contact our office. The phone number is listed here on the slide. Option 3 will get you through to our scheduler, so you don't have to wait for the prompt to do that, and set up a consultation with one of our physicians. We could do many things. That may just be sort of assessing your symptoms and seeing if you qualify for additional medical therapy, help decide your compression stockings, exercise programs, blood thinner durations, etc., and work you up further from there. See if you do have blood clots, if you've had a history of stents or any issues, if you need other imaging, or you may benefit from a procedure to fix some of those things as well. Okay. Thank you very much for your time. It's been a pleasure speaking to all of you. And please don't hesitate to reach out.